Good afternoon, dear students. The Department of Histology and Embryology represented to you the lecture Sensory Organs. One of the main sensory organs in human body, this is the eye. But the central nervous system receives some information as for the outside world and their inner state of the organism with the aid of senses. The sensation resulted from this information reflected something exciting regardless of our consciousness, the objective reality of everything around us. And today we will discuss the question, how does realize all these sensations from the main sensory organs of main sense organs of our body. And really our sense organs is represented some sensory receptors, the receptors and special organized organs like oculus or organ of vision and organ of hearing, inner ear, and also some olfactory zone like olfaction feelings and of course taste buds. But the special attention for today our lecture is classification of sensory receptors, list of the receptors that fit into each class, description of general features of the sense organs, the major steps of the embryonic development of eye, compartments of eye, and also we have talking about the structures of eyeball, description of sclera, layers of cornea, the layers of retina, special characteristics of rods and cones in retina and in other neurons. And you need to know the main keywords for the identification. This is knowledge, and to remind that keywords to have to remind you this knowledge after time. Like example, sense organs, Tunica Fibroza, Cornea, Limbus, Sclera, Haloid, Ciliary Body, Iris, Retina, Pigmented Epithelium, Photoreceptive cells, rods and cones, visual pigment, iodopsin, bipolar cells, ganglion cells, horizontal cells, Muller cells, fovea, vitreous body, optic disc, optic nerve, and some another supporting terms of the oculus, eye, and organ of hearing. That's the general aim of our study. This is investigation of histophysiology of eye and histophysiology of hearing, auditory system. So this is different types of eye, which is present in this GIF type of files. And started main materials definition. So the eye is a peripheral portion of brain. It's very important to know that the eye is peripheral portion of brain, which is also complex organ, refines and projects images into its photosensitive retina, which is subsequently generates the signals interpreted by the brain as a vision. And the basic structure of the eye is a globe eyeball comprised of three tunics, like tunica interna, retina, is a photoreceptorical layer which is contain 10 neuronal networks, 10 layers neuronal networks. Tunica vasculosa. This is the vessels of eye. And, sorry, one moment. And Tunica fibrosa. Tunica fibrosa, this is a sclera, outermost layer of eyeball. Let's now, we started from the embryonic development of eyes and related structure. As you have seen here, we have seen that the eyes begin to develop in 22nd day of embryo, when optic grooves appear. Look at this one, is optic grooves. Optic grooves. That appear in the region of diencephalon, And what is it, 22nd day of embryonic development? 22nd day of embryonic development, that's the time when the heart starts to beat. Heartbeat start. And of course, many important organs is not completed fully. Like example, the brain also continues development, not completed yet. And in one moment, as you have seen here, the diencephalon is present, like component of, like one of the ventricles and brain vesicle is present, but and this is time of the third brain vesicle. And one moment we have seen that the forebrain is only start to differentiate. So, result that eyes are derived from the four sources. First is narrow ectoderm of the forebrain, surface ectoderm of the head, mesoderm between the previous two layers, and neural crest cells. When we're talking about mesoderm, we are talking about mesenchyme, ectomesenchyme. Look, that's first of all is narrow ectoderm. Narrow ectoderm differentiates into the retina, posterior layer of iris, and optic nerve. This is component which arise from narrow ectoderm. From another side, surface ectoderm forms the lens placode. After that will be transforming to lens of eye, and corneal epithelium. Yes, again, look, surface ectoderm, lens of the eye, and the corneal epithelium. The mesoderm between the narrow ectoderm and surface ectoderm give rise to fibrous tunica fibrosa, fibrous layer, and vascular cords of the eye. Tunica fibrosa and tunica vasculosa. They are derived from mesoderm, but originally it will be ectomesenchyme. All type of mesenchyme in the head arise from neural crest. Look, neural crest cells migrate into the mesenchyme and differentiate into the haloid. Haloid plexus is one of the main type of vascular elements of vascular cords. Okay, neural crest cells. Neural crest cells migrate into the mesenchyme and differentiate into haloid, sclera, and corneal endothelium. Haloid is understandable. This is a vasculosa, tunica vasculosa. Sclera, this is tunica fibrosa. Outermost layer, white color, which is consists from dense, irregular connective tissue. And one moment that's a corneal endothelium, which is also arise from ectomesenchyme, but as a simple squamous epithelium, it covering the cornea from inner surface. The first evidence of eye development is appearance of optic grooves look at this one, we have very good seen optic grooves, left and right. And optic grooves in the neural folds of the cranial end of the embryo, as the neural folds fuse to form the forebrain in future. So optic grooves evaginate. Look at this one, we have seen very good visible optic vesicle. In evaginate, protruded from the future diencephalon to form hollow diverticula. This is hollow diverticula outpocketing, called ordinary optic vesicle. Look at this one, we have seen very good visible here. Optic vesicle, optic vesicle. And project of the wall of the forebrain into the adjacent mesenchyme. The vesicles soon come in contact with surface ectoderm, as we have very good seen here. Surface ectoderm to form invaginating lens placode. The human embryo, as well as another mammal's embryo, get a special thickening of surface ectoderm, which is ordinarily named placodes. That placodes can be divided on three types. First is a lens placode, future lens of eye. Second, this is nasal placode, future nasal cavity and vestibulum of the peripheral part of the nose. And third, this is otic placode. Otic placode, that's a future otic vesicle for inner ear. And all that's placodes, lens placode, otic placode, nasal placode arise from surface ectoderm. Let's continue. Next is a formation of optic vesicles is induced by mesenchyme adjacent to the developing brain. It's very important for us. Look at this one. We have seen forebrain. This is forebrain. And we have seen that's part of the diencephalon where is the start the formation of optic cup. This is a type of optic cup now. And lens placode, which differentiate into the future lens. It's very important that developing of eye and developing of ear is a classical example of theory of embryonic induction. Embryonic induction theory to describe how does the embryonal tissue interacted during formation of internal organs. And one of the important of organs, of course, is eye and inner ear. And about the eye, as the optic vesicle growth, their distal ends expand and their connection with the forebrain constrict to form the optic stalk. Look at this one, very good visible optic stalk. This is optic stalk from left, and from right is not very good seen because not sectioning from this embryo. It doesn't mean is absent, but it means indices objects is not be good seen. What does it mean, optic stalk? Optic stalk join the optic vesicle and forebrain of future diencephalon area. Look at this one. We have very good seen here that inside optic stalk is present the cavity, and that cavity also present between inner and outer layer of optic cup. So optic cup originally contained two surfaces, that's inner and outermost, and the lens placard is invaginate inside. Lens placard is surface ectoderm, optic vesicle and optic cup, this is neural ectoderm. Between surface ectoderm and neural ectoderm is present mesenchyme, which is migrated between these two types of layers. In the next slide, we very good seeing all the steps of brain and eye formation. Like first is optic grooves, like the first, again, optic grooves, not very good, oh yes, optic grooves. Next, optic vesicle, look at this one, lens placard, optic stalk in the early stages. Next, invagination of lens placard, optic stalk comprise, and we have differentiation of the forebrain and diencephalon. This is electron scanning micrograph, which is also very good seeing the optic vesicle and lens ectoderm. Also is very good seeing how the brain vesicle is present, hindbrain, midbrain, and forebrain. And we just talking about forebrain differentiation of diencephalon. In the schematic diagram is very good visible all types of the brain elements, like example myelencephalon, metaencephalon, mesencephalon, diencephalon, and telencephalon. What is it? This is a result of organic morphogenesis, neurogenesis of the brain, and from the three brain vesicles, hindbrain, midbrain, and forebrain, we have five vesicles, like myelencephalon, myelencephalon, metaencephalon, mesencephalon, diencephalon, and telencephalon. We'll continue our discussion. Optic cup. It's very important to understood that optic cups, it's a double structure from left and right, and each optic cup is result of developing of optic vesicles. Invaginate to form the double-walled optic cups, which consist of two layers that are connected to the developing brain by optic stalk. The optic cup becomes the retina, and the optic stalk. So becomes the optic nerve originates from optic stalk. Retina arises from outer layer of optic cup, but the optic nerve arises from optic stalk. The lens and part of corneal epithelium development from the ectoderm and mesoderm, original ectomesenchyme. The opening of each optic cup is large at first, but the rim of the cup infolds around the lens. So it means that lens invaginate inside optic cup. By this time, the lens we have talking about the photomicrograph as sagittal section of the eye at embryo in approximately 32nd days, and observe the primordium of the lens, invaginated lens placard, which evolves the optic cup, primordium of retina, and the optic stalk, primordium of optic nerve. And we have to see this is invagination, but now we have seen the light microscopic technique invagination. Look at this one. We have seen here surface ectoderm. Look, we very good seeing surface ectoderm is more thicker, as well as optic cup is also very thick layer of epithelium. But this is epithelium is epithelium of neural ectoderm. And we have seen some elements like a cavity of optic stalk. Also we have seen intraretinal space, this one. And we have seen two layers of future retina. Outermost layer and innermost layer. Innermost, this one. Innermost and outermost. So outermost layer, it will give rise to formation of pigmentum epithelium. Pigmentum epithelium. Innermost will give rise to formation of yes, look, we have seen here the outer optic cup primordium retinal pigmentum epithelium here is inverted. I mistake. I'm very sorry. Inverted, so opposite from the structure of this. And that's elements of inner layer of optic cup. It's the 9 layer of retina. 9 layer of retina is inner layer of optic cup. But outer layer of optic cup will give rise to formation of retinal pigmented epithelium. Retinal pigmented epithelium. What does it mean? It means that original optic cup and optic vesicle, it's a part of the brain vesicles. It's a branching of brain vesicles, which contain the lumen, and in lumen we have seen there some elements of fluid, maybe like cerebrospinal liquor, and the same here is also possible. But during transformation, this is spaces, cavity of optic stalk and cavity of intraretinal space, will disappear during the formation. Example, we have seen here the next stage. In the 44 days of development, very good visible retinal pigmentum epithelium, outermost layer. Innermost neural epithelium. This is future 9 layer of retina. Next, anterior lens epithelium, lens fibers, ordinary crystalline fibers name. Next we have seen iris, which arise from optic cup, neuroectoderm, iris. Vitreous body arises from ectomesenchyme. This is mesenchymic structure between lens and between optic cup. Surface ectoderm, outermost, and sclera. Sclera, haloid, also arise from mesenchyme. Look at this one. Haloid arise from mesenchyme, and sclera. Sclera is also developed from mesenchyme. Well, what about neural retina? That the vesicles have lost their connection with the surface ectoderm and have entered the cavities of the optic cups. Linear grooves, retinal fissure, develop on the ventral surface of the optic cups and along the optic stalk. The center of the optic cup, where the retinal fissure is deepest, forms the optic disc. This is optic disc, center of the future fovea centralis, and where the neural retina is continuous with the optic stalk. And of course, blind spot also. That's developing axons on the ganglion cells pass directly into the optic stalk and convert into the optic nerve. Myelination of nerve fibers, forming this shift around the fibers, begins during the later part of fetal development and during the first postnatal year. So the formation of eye continues after childbirth, continues. Because that many people don't understand that when baby is born, he's very good feel father and mother, but feel by scent, feel by olfactory senses, but not have good seeing. That vision is not complete developed, especially it continues to develop during the first year of life. Summary. Let's say eyes begin as the optic vesicle. It induces the ectoderm to form the lens placard, and the part of the vesicle containing the ectoderm invaginates to form the double-walled optic cup. And the cup subsequently forms the tunica interna retina, its outer layer from the retinal's pigmented epithelium, and its inner layer from the photosensitive neural retina. Result: that a stalk connecting the optic cup to the brain becomes the optic nerve. The lens placard thickens and invaginates to form the lens vesicle, which pitches off to form the lens and position itself into the mouth of the optic cup. Mesenchyme. The mesenchyme condenses around the tunica interna to form the globes two outer tunics, the outermost tunica fibrosa and innermost tunica vasculosa, which lies between the fibrosa and interna. And we have seen our eyeball like a system of very difficult organized organ. We have seen eyeball which contain tunica fibrosa, tunica vasculosa, also very good seen. Tunica fibrosa is sclera, tunica vasculosa haloid. Next we have seen the retina interna, tunica interna retina. In retina we have very good seen macula, which is named fovea centralis. Fovea centralis, this is a special area where is a higher concentration of cones for good color vision. And a little lefted will be optic disc. Optic disc, it's a blind spot, where is the optic nerve is begins. Because if we have to trying to identify it, blind spot is possible with special tablets. That tables is sometimes is present in the ophthalmological center for identification. We just not talking about it, maybe you will more important to study in ophthalmology. And next, we have seen also retinal blood vessels. This is retinal blood vessels, it's a branching of haloid plexus. We have seen vitreous humor and haloid canal. You can ask me, how does it possible? Because we doesn't have any canal inside the eye. Yes, in the mature eyes doesn't have, but in embryonic present, because till the 7 months of prenatal life, this is haloid canal is present, like elements of haloid arteries. But the haloid arteries degenerate and the canal also degenerate. But sometimes, like pathological rudiments can be represented. In this case is needable special ultra microscopical surgical operation, but it's not very often, very rare. And also we have seen lens, as you remember, arise from surface ectoderm, and this is epithelial special lens. Yes, special organ. We also have seen that lens is joined with wall of eyeball by ciliary body, and cil tendon, a special junctional complex. And one moment we have seen iris. Iris, as well as ciliary body, arise from neural ectoderm. But ciliary body and iris, it's of course muscles, especially iris. It's a modified muscle cells, like smooth muscle cells, but it originates from neural ectoderm. It's very important to remember what's the origin of iris and ciliary body. And we also have seen the suspensory ligament of lens. This is a tendon of cil tendon. And we also have seen anterior chamber aqueous humor, filled by aqueous humor, and interior chamber, but also very good visible, more expanded cornea with 5 layers inside. Between cornea and iris we have seen a pupil, and this pupil is a result of the iris-like system of contraction and relaxation of this iris muscle and ciliary body. Well, ciliary body also can to improve the changes of lens. The shape of lens can be changed during the focusing. Well, thank you very much. Let's now we are talking about the system of analysator system. The famous Russian physiologist Ivan Pavlov, he was been the Nobel Prize laureate who was investigates the digestion in dogs, but his Nobel Prize about digestion of gastric juice synthesis, but the second great foundation is a study of analysator system. What does it mean, analysator? According to Ivan Pavlov, analysator, this is a complex of receptor and sensory organs which join with the central portion of the central nervous system. And we have seen here peripheral portion of analysator system is ordinary receptors, different type, like example, olfactory epithelium in vemeronasal organ, or maybe this is rods and cones in retina, like receptors, photoreceptors, or maybe test buds receptors. It's peripheral portion, receptors of sensory organs. Second, intermediate portion, it's a conducting pathways. Ordinary, this is nerves, like auditory nerve, this is maybe visual nerve, yes, and optic nerve, another name, yes. And one moment we're talking about some portion of midbrain and elements of thalamus, like a subcortical center of sensation. Thalamus is the highest level under the cortex. And the last, the main central portion, neuronal network of the cerebral portion. Ordinary, this is cerebrum, like main elements. According to the organization of receptors, we have to identify two types of sense organs: primary sense organs and secondary sense organs. What does it mean? It means that the primary sense organs, this is the organs which organize from the original neurons, like receptorical cells, original neurons. But the secondary sense organs, this is receptors which organize from modified epithelial cells. Example, epithelial sensory cells, epithelial sensory cells. Examples, please, we have seen it in this next slide. From the left part, we have very good seen rods and cones. As you have seen, it consists from cell body with a nucleus and processes, axons and dendrites, In this case, this is axons and dendrites modified in the special outermost and innermost segment. Any of it contain special mitochondria, special cilia, and both get the plates which is very good phagocyted by the pigmentum epithelium. This one itself is pigmentum epithelium. What does it mean? It means that pigmentum epithelium to phagocyte the segments of rods and cones, as effect of it, start the impulse of activation, and this is impulse, neuronal impulse, to transmit it through the inner segment. So this is a classical neurons. In opposite, in the case of test buds, this is test buds. It's very good visible that's epithelial cells joined with a sensory nerve ending. These cells is not neuron. This is two types of cells. One type of cells is supporting cells. Another is a epithelial sensory cells. That is, epithelial sensory cells get a special microvilli, test bud pore, and it ordinarily closed by the special glycoproteins layer, and the main, this is epithelial cells, is joined with sensory ending, nerve ending. This is sensory nerve ending joined with special ganglions. Remember, primary sensory organs never contain ganglion inside the organic structure. Example, eye doesn't any ganglions in the structure. Or maybe olfactory epithelium of vemera nasal organ also doesn't have any ganglions. But if the ganglions present inside, example, spiral ganglion of cochlea, or maybe lingual ganglion of tongue, that's to show that this organ is secondary, not primary, and contain modified epithelial sensory cells. Thank you very much for that. And now we continue our talking about the organ of vision and discuss tunica fibrosa. Tunica fibrosa. The eye's outermost tunic has two main components: The anterior 6 forms the transparent cornea, and posterior 5-6 forms the opaque, the white sclera. The junction between the cornea and sclera is named limbus. It's a very important moment. Limbus, this is the area where is the place where is to join any type of tissue. In the eye, in limbus join the cornea, cornea epithelium, cornea connective tissue proper, and endothelium with a sclera, dense irregular connective tissue, and with also elements of tunica vasculosa, portions, like example, canal of Schlemm. Anyway, limbus a special area because many types of tissue to join each together in limbus. Tunica fibroza provides the taut fibroelastic support of the eye. Well, look at this one, we have to see properly. First of all, sclera, outermost layer, tunica fibrosa, retina, innermost layer, tunica interna, choroid, tunica vasculosa, it's located between, ciliary body, located especially in the region of limbus. Look, this one, cornea, iris, canal of Schlemm, Schlemm canal, and ciliary body. And here also visible sclera and muscle, the orbital muscle of eye. That is very important. That's the limbus. It's an area where is to join many tissues. Well, cornea. This transparent, clear, avascular disc, transparent, clear, avascular disc, without any vessels. Remember, who will tell me that in cornea, present any vessel, have bad mark? Because it's avascular disc, cornea, transparent, clear, avascular disc. Balding from the front of the eye, has a smooth surface, it's not curved unfirmly. The central optical zone, has a smaller radius of curvature that does the periphery, and the posterior surface is more strongly curved than the anterior. So that's very important for light migration. Cornea is a thinner, 0.7 to 0.8 millimeters, centrally than 22nd, and its margin 1.1 millimeters. The refractive power of the cornea, a function of its refractive index and its radius of curvature, is greater than that lens. It's very important. The lens is supporting elements, but the cornea is the first. It's also named like dioptrical apparatus of eye. Cornea, lens, vitreous body, dioptrical apparatus of eye. Anatomically, the cornea consists of the cornea proper and the limbus and transitional zone, about 1 millimeter wide at the periphery, that contains the blood vessels and lymphatics vessels. Look at this one. We have seen here outermost epithelium of cornea. But original name, this epithelium, is stratified, squamous, non-keratinized epithelium. As you remember, we was studied in the first team of tissue, epithelial tissue. Stratified, squamous, non-keratinized epithelium. Another name, outermost epithelium of cornea. Next, will be Bowman's membrane. Bowman's membrane is a result of special product, epithelia and connective tissue between outermost epithelia and cornea proper. Cornea proper is the main elements of connective tissue, but it's very important that is transparent and avascular and doesn't have the cells. The cells is not visible here because a lot of hyaluronic acids and glycosaminoglycans. Next, this is a Vesimeter membrane, and the next is a Vesimeter membrane. It's analogous of Bowman's membrane, but it's a result of active production of innermost epithelium and cornea proper. That's innermost epithelium, ordinary name endothelium. This is a simple squamous epithelium of cornea. This epithelium interacts with the outer chamber of eye, and it's a good interacts with the aqua fluid, and this is to provide some feedings elements which is releases from the Canal of Schlein in the Limbus, because that proteins, amino acids, oxygenium, and some carbon dioxide back migrated through the barrier in Limbus, which is named Canal of Schlein, but is not migrated lymphocytes, macrophage, leukocytes, not any immune cells, because the cornea, as like elements of eye, can be translocated or maybe replacement from one person to another without problem of immune reaction. So we have to transplantate the cornea between different people, sometimes between the dead body, if very fast to do it during the first maybe 30 minutes after the humans die, and we have to replace the cornea without any problem with cell-mediated immunity. It's a good adaptate for the new place. Okay, a cross-section of the cornea shows the 5 layers. Anterior epithelium, again repeat, this one is anterior epithelium. One moment. Externally, the stratified squamous non-keratinized epithelium, 50 micrometers thick, with 5 of 6 layers of cells. Basal layer of lower columnar cells, 3 of 4 layers, polyhedral and winged cells with name, winged cells, and other 2 layers surface squamous cells, outermost. Next, Bowman's membrane, anterior limiting lamina. Bowman's membrane. In this picture, we have seen it only here. Bowman's membrane is a cells-free 8 micrometers thick basement membrane composed of a ground substance and a felt fork of a fine collagen type 1 fiber. It is believed that Bowman's membrane is synthesized by the both of corneal epithelium and cells of the underlying stroma or cornea proper. That the sensory nerve fibers pass through this structure to enter the terminate in the epithelium its ends of ad rapli and the limbus. What does it mean? It means that in the Bowman's membrane present some neuronal sense fibers, but the main of them is located in limbus again. Because that the cornea reflex is very famous. We have to know that if, for example, a person is asleep, maybe sleep, sometimes any people sleep with open eye, but if we have to touch the cornea, we have the reflex, and the eye is start move. But of course, that reflex is not be work if the dead body, and that's a result of innervation of cornea through the limbus also. And the next we have to see here the limbus. Look at this one; it's very good visible. This is a special ciliary muscle. Ciliary muscle to join with the lens. This is lens. We also have seen the outermost chamber with aqueous liquor, and we have seen the canal of Schlemm. Okay, this is the canal of Schlemm. It's the main large vessels which to provide the trophical effect for cornea and for limbus. Next, Substantia Propria. That's a stroma. Stroma of cornea is named Substantia Propria. 90% of the thickness of cornea is composed of lamella of collagen type 1. Fibers arrange the mainly layers of lamella at different angles. We have seen it here, is visible. A ground substance between lamella contains a chondroitin sulfate and keratan sulfate, and between the bundles of collagen fibers are stellate flattened fibroblasts, but is not very good visible because to effect like transparent. Okay, canal of Schlemm in limbus. In canal of Schlemm we have that the limbus sclera corneal junctions. To write now in your notes, limbus is named special. Sclera corneal junction is a scleral sacculus where the inner aspect of the stroma is depressed and houses the endothelium-line spaces known as a trabecular meshwork that lead of the canal of Schlemm. Schlemm is a name of scientists who will be described. That the canal of Schlemm is the site of outflow of the aqueous humor from the anterior chamber of the eye into the venous system. And now, understandable, that's very important role of this is canal of Schlemm during the aging of human in the time of arteriosclerotic changes. As maybe you know, there's some diseases like cataract. Cataract result of dysfunctions of lens. When lens fibers is degenerates and maybe have to change the structure of the crystalline protein inside lens fibers. As lens fibers is not a fiber, it's cells, special name of cells. That's a cataract to prevent normal vision. Ordinary name blind spot, white spot in the eye. In people, in the ordinary talks. And another type of disease, this is a glaucoma. Glaucoma is disease which is also a problem with the canal of Schlemm, but in this case increase the inner pressure of eye. As effect of it, it's also problem with vision, But in this case, we need not only replacement of lens. Ordinarily, it's possible in a cataract to remove lens and put on the place of lens artificial lens, maybe from which was made from the plastic, of course, very high quality. But in case of problem with the Schlemm canal, dysfunctions, maybe atherosclerotic changes, is need a special surgical operation. The canal of Schlemm is the site of outflow of aqueous humor from the anterior chamber of eye into the venous system. The vessels of this highly vascular ring-like junction between the cornea and sclera, together with the fluid of anterior chamber, nourish the avascular cornea. Near the limbus, the stroma contain the endothelial canal called the Schlemm canal, which drains fluid from the anterior chamber towards the limbus. Okay. And clinical correlations, the blockage of this canal raises intraocular pressure and causes a glaucoma. Here, the corneal epithelium thickens to 10 more layers and continues with the conjunctiva. Bowman's membrane ends abruptly. The cement membrane splits up to become the continuous with the trabecula of the pectinate ligament, and the corneal stroma becomes less regular and blends with the sclera. What about the cement membrane? The posterior limiting membrane of cornea is ordinarily 5 to 7 micrometers thick centrally, but thickens in 8 to 10 micrometers peripherally, where it's continuous with the material of the trabecular meshwork, pectinate ligament, also known, at the ring of Schwalbe. Schwalbe is a German scientist who was described it. Its networks of atypical collagen fibers is decorated with a granules. And the last 5 layer is named corneal endothelium. Posterior epithelium is a simple cuboidal epithelium, not simple squamous but simple cuboidal epithelium lining the corneal internal surface. It's responsible for the synthesis of proteins that are necessary for secreting and maintaining the cement membrane. These cells exhibit numerous pinocytotic vesicles, and their membranes have sodium pumps that transport sodium ions. Into the anterior chamber, these ions are passively followed by the chloride ions and water. And the last sclera. This opaque white connective tissue covers the eye posterior 5-6. And this is dense fibrous tissue 1 mm thick posteriorly and 0.8 nanometers thick anteriorly, but only 0.3 mm thick at the equator. It's composed of the flat bundles of collagen fibers, mainly running parallel to the surface. It's anchored in the orbit by the dense connective tissue or tendons capsule. Tenon's capsule. Tenon is the English scientist who was described. The sclera has the 3 layers. The episclera is the sclera outermost layer of fibroelastic tissue. Episclera. Look at this one, we have seen it here. Episclera outermost. The Substantia Propria is a dense mat of collagen bundles and fibroblasts that form the sclera's thick middle layer where the ocular muscle inserts. The lamina fusca. This consists of loose connective tissue. Is the sclera inner layer. This is outer layer, this is inner layer. This is haloid plexus. Haloid plexus. This is inner layer is named lamina fusca. Lamina fusca. It contains elastic fibers and melanocytes and is separated from the haloid by the narrow perihaloidal space. Look at this one, we have seen it. Perihaloidal space, narrow perihaloidal space. Posteriorly, the sclera is perforated by the optic nerve and the lamina fibrosa. The last layer is a lamina fibrosa posteriorly. Again, episclera, outermost, lamina fusca, innermost, and perforated by lamina fibrosa. Lamina fibrosa. Thank you. Next is a tunica vasculosa, uvea, tunica vasculosa. This is a middle tunic of the eye. It has three major components: haloid posterior, ciliary body, and iris anterior. Haloid lies between the sclera and the retina pigmentum epithelium and has four layers. The suprahaloidal lamina resembles the sclera's lamina fusca, from which it is separated by the perihaloidal space. We have seen it here. Look at this one. We have seen haloid. Sorry, one moment. Again, this is haloid. From outside, again, lamina fusca outside, and perihaloidal spaces also visible here. Well, next will be retina. 10 layers of retina, very good visible, but we will discuss after time. Okay, the vascular lamina comprises a loose connective tissue with many row-like veins that converge to form four larger vortex veins, which exceed the back of the eye through the sclera. The hariocapillary layer, again, hariocapillary layer, hariocapillaris, shortly. It's a layer of penetrative sinusoids embedded in the loose connective tissue. And last, this is a branch membrane. So again, back here, first in tunica vasculosa. In tunica vasculosa, we have to remind that first is a four layer, yes, suprahaloidal lamina. First, suprahaloidal lamina. Second, this is haloidal capillary layer and branch membrane. Okay, this is the haloid's inner layer, is the basement membrane of the retina's pigmentum epithelium. Well, now the ciliary body. The ciliary body, very good visible here. Look at this one, ciliary body. The ciliary body extends forward from the haloid as a ring-like triangular thickening at the levels of the lens. Triangular. Look at this one. 1 triangle, 2 triangle, 3 triangle, 4 triangle, and we have seen it practically triangle. Triangular thickening of the level of the lens. It was the same layers as the haloid, minus the hariocapillaris, without hariocapillaris. Its primary structural components are the ciliary processes and the ciliary muscles. The ciliary processes are irregular epithelium-covered connective tissue outgrowth of the ciliary body that extend toward the lens. They serve as a region for the fibers of the circular ligament or thin zonule. This one is have seen like a tendon, but originally is named thin zonule. So outermost is epithelium lining, but inside muscle, but at outside it's joined with a thin zonule. Okay. The functions of ciliary body, which insert the edge of the lens to anchor the two-layer of pigment epithelium covering these processes, derive from the layers of optic cup. The inner ciliary epithelium borders the internal cavity of the eye. Its cells have the basolateral plasma membrane, enfolding the typical of iron and water transporting cells. They secrete aqueous humor. So, ciliary body secrete aqueous humor in anterior and posterior chamber. Ciliary muscle. The ciliary muscle comprise the three smooth muscle bundles near the junction of the ciliary body and sclera. The contraction of all these muscles pulls the ciliary body and haloid forward, releasing the tension of the zonula and allowing the lens to become rounded in near vision. So it's important for change the allowing of lens. And the relaxation of all groups increases the tension of the zonule, flattening the lens to allow focus in distant objects. So you have seen that especially ciliary muscles to change the shape of lens. Because with the time during the senescence, during the high attention, heavy vision work, maybe in computer game, maybe in the works with a PC for writing materials in PC, maybe personal computers, yes, have been very higher pressure, higher tension, and affect start some disorders, like a famous is named with a problem with ciliary muscles and lens. It's accommodation of lens, and the fact is problem with vision, which is also have been studied in practical classes. Now we little talks late. And this structure controls the amount of the light that reaches the retina and gives the eye its color, the iris. Its front of the lens is projected as a flat ring from the ciliary body, leaving the circular opening, the pupil, at its center. And iris includes the most anterior extension of the tunica vasculosa and tunica interna, forming the border between the anterior and posterior chamber. Especially iris give a color of light. Anterior chamber. The anterior chamber lies between the cornea and the iris. The posterior chamber lies between the iris and the lens zonular complex. The anterior surface of iris is rough and contains the pigment cells and fibroblasts. It's a stroma and poorly vascularized connective tissue with a fibroblast and melanocytes. The vascular stratum between the stroma and posterior surface has mainly blood vessels. The posterior surface is smooth, heavily pigmented, and continuous with a double layer epithelium covering the ciliary processes. Ordinarily, this is the involuntary muscles. Involuntary muscles, the sphincter pupilla, it's a ring, a smooth muscle in the pupillary margin that contracts under the parasympathetic control, partly closed with the pupil. The dilated pupillar fibers, which extend like spokes between the ciliary body, and the pupillary margin contact under the sympathetic control to open the pupil. Parasympathetic, close pupil. Sympathetic, control, open the pupil. Okay. That's the next interesting mesenchymal region component of the eye, it's a vitreous body. This transparent, gel-like body, most water and hyaluronan, or hyaluronic acid shortly, fills the large vitreous space between the lens and the retina. Some peripheral fibrils forms its capsule. It contains a few macrophages and hyalurocytes, stellate cells with oval nuclei that produce the fibrils and hyaluronic acid, hyaluronan. So, remember, stellate cells, which is named hyalurocyte. This is the cells of vitreous body. Maybe in some tests you have to find what does it mean, hyalurocytes. Or maybe you may be asked, what's the name of stellate cells of vitreous body? Again, hyalurocytes. And that cells produce hyaluronic acid and fibrils. During the development, the central artery extends from the optic disc through the vitreous to the lens as a haloid artery. It subsequently degenerates, leaving the narrow haloid canal. And now we're talking about lens. Lens, this is a transparent, elastic, biconvex structure of epithelial origin. Nourished by aqueous humor, it has neither blood nor nerve supply. It's suspended by the zonula of the ciliary body behind the pupil. Ciliary muscle contraction change the curvature of the lens to the enable focus of objects near or far, and process called accommodation. The lens has three main components. The lens capsule is elastic and transparent basal lamina that covers the entire lens and prevents the wandering cells from penetrating it. It consists mainly of the 5 type 3 collagen type 1 and 3 and type 4 collagen fibrils embedded into the glycoprotein and glycosaminoglycans rich matrix. Subcapsular epithelium, the higher of his low cuboidal epithelium beneath the capsule of the anterior lens surface increases to columnar near the lens equator, where the cell's division occurs. So at the periphery, it's a cell's division occurs. In the center, no any nuclei and no any division. Its cells contain a few organelles and form the lens fibers. Lens fibers are long, narrow, hexagonal, specialized epithelial cells that make up most of the lens. During the differentiation, they lose their nuclei, fill the proteins called crystalline, and develop the variety of specialized plasma membrane components, including the junctional complex, ridge-like processes. Crystalline belongs to the family of the head shock proteins because with a senescence can be degenerate. Example: capsule, you have seen capsule red color. Next is a subcapsular epithelium, it's a columnar shape, and crystalline fibers. It's without nuclei because the nuclei is periphery. And the next layers, tunica interna retina. This is a main component of the eye because it provides the fillings. The main fillings is result of interactions of neuronal networks of retina. Pigment epithelium, number 1. Second, layer of rods and cones. Third, external limiting membrane. External limiting membrane is a product of processes of Müller cells. Müller cells, this is a modified glial cells, modified glial cells. Outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, ganglion cell layer, optic nerve fiber layer. So that optic nerve fibers is started from ganglion cells layer. And the last, internal limiting membrane. The internal limiting membrane, it's again processes of Müller cells. Look at this one, we have seen it. How does it visible? We have seen from the retina, it's inverted. So light is migrated from here. Light migrated and migrated through all the 10 layers of retina. First layer started near the haloid. This is a pigmentum epithelium. Next, this is the rods and cones layer, outer limiting membrane, outer nuclear layer, outer plexiform layer, inner nuclear layer, inner plexiform layer, ganglion cells layer, look at this one, the larger cells, ganglion cells layer, nerve fibers layer, and inner limiting membrane. It's very easy, maybe very heavy, but not, it's possible to study really. Look at the correctly picture. Sorry for Russian prescription, but we are needed the shape of cells. Very interesting for us. First of all, pigmentum epithelium. Look at this one, is very good visible pigmentum epithelium. Next, this is rods and cones layer. Rods and cones layer is very good visible. Neuronals, first neurons. This is Müller cells. Look, Müller cells. That's a glial, modified glial cell. We have seen the outer limiting membrane. Outer limiting membrane and inner limiting membrane. So also we have seen the inner nuclear layer that is present like, present like horizontal cells and also present nuclei of rods and cones. Also, inner plexiform layer is present bipolar cells and amacrine cells. Plexiform layer, also we have seen plexiform layer and inner nuclear layer, and also we have seen ganglionar cells layers. We have seen very large nuclei of ganglion cell layer. And the last is axons of ganglional cells. This is nerve fiber layer. Rods and cones. That's rods and cones. It's modified neurons which characterize metabolic region which to synthesize the special proteins. Proteins is named rhodopsin in rods and iodopsin in cones. In rods, rhodopsin, in cones, iodopsin. We have seen also a lot of mitochondria in cones, mitochondria more than in rods. And also we have seen that cilia, special junction between outer and inner segments, and mitochondria is visible. That's in this picture, in this schematic diagram, we have very good seen how the pigmentum epithelial cells phagocyted the outermost segments, plates of cones and rods. Cones and rods. Is a good visible, that's a production of granules of melanin. It's the functions of pigmentum epithelium. Disc was being phagocyted the disc, and transportation of sodium and potassium ions, especially in the moment of phagocytosis of disc plates of outermost segments of rods and cones. take place the moment of generation of impulse, nerve impulse for feelings of different photons of light. And that's impulses accumulate via the process of convergency, and after that divergency in the cerebral cortex. Primary, it will be convergate in optic nerve, after that divergency in the cortex, cerebral cortex. Okay. And let's now talking about very shortly talking about the organ of hearing. That's in other organs of sense, sensory organs arise from ectoderm and neural ectoderm, but dominated in this case surface ectoderm. We have seen placodes, nerve tissue from nervous tube, and neural crest. Three derivatives. And very good seen the area of embryo where is to form this is organ of sense. The ear or vestibular cochlear apparatus has the dual sensory functions of maintenance of equilibrium and hearing, stata acoustic system. The ear is a three-chambered sensory organ that functions as an auditory system for sound perception and as a vestibular system for balance. Structure. Structurally, the system may be divided into the three parts of external ear, middle ear, and internal ear. Each of the three dimensions of the ear, the external ear, middle ear, and internal ear, is an essential part of auditory system. The external and middle ear conduct sound energy to the internal ear. There the auditory sensory receptors converted the energy into the electrical impulses. Function. The specific sensory receptors for both movement and sound are situated in the membranous structure located in the internal ear, while the external and middle ear are concerned with the reception, transmission, and amplification of incoming sound waves. The ear are composed of the three parts: external, middle, and internal. And we have talking about internal ear first. Internal ear consisting of the vestibular cochlear organ, which function is hearing and balance. Development of hearing. The internal ear are the first of the three parts of each ears to develop. Early in the fourth week, it arises like a thickening of a surface ectoderm. The otic placoid appears in the preplacoidal fields of precursor neurons on each side of the myelencephalon, which is the caudal part of hindbrain. Again, so otic placoid appears in a preplacoidal field of precursor neurons on each side of myelencephalon, which is a caudal part of hindbrain. Embryonic induction. Inductive signals, including those fibroblast growth factor 3 and fibroblast growth factor 10 from the paraxial mesoderm and notochord, stimulate the surface ectoderm to form the otic placoids. Second moment, the formation of otic pit. Each otic placoid soon invaginates and sinks deep to the surface ectoderm into the underlying mesenchyme. So doing it's from the otic pit. Development of inner ear is very good, visible here. Look at this one. Otic placoids very good seen here and here. Otic pit, again we have seen during the formation of 22nd day of development. Otic pit start to form otic vesicle. Look at this one, otic vesicle, and from the neural crest cells to form the future spiral ganglions, and it's to have two interactive of it. We have sacculus and utriculus, and we're just talking about otic vesicle. The edges of the pit come together and fuse to form the otic vesicle, which is a primordium of the membranous labyrinth, and the lymphatic duct and sac. The vesicle soon loses its connection with the surface ectoderm, and the diverticulum grows from the vesicle and elongates into the form and the lymphatic duct or sac. Look at this one, we have seen utriculus and sacculus and the formation of endolymphatic duct. The two regions of otic vesicles are recognized. Dorsal utricular part, which is a small endolymphatic duct. Utriculus and semicircular duct arise. Ventral saccular part, which give rise to the formation of sacculus, and cochlear duct. The three disc-like diverticula grow out from the utricular parts and primordial membranous labyrinth. So the central part of these diverticula fuse and disappear. The peripheral unfusible part of the diverticula becomes semicircular ducts, which are attached to the utricle and later enclose the semicircular canal of the bony labyrinth. And we have seen how does it forms, and the lymphatic duct, cochlear duct, sacculus, utriculus, absorption focus, cochlear ducts start spiralized. Inside of the bony labyrinth, we have seen the formation of membranous labyrinth. Okay. Localize the dilatations of ampulla, develop the end of each semicircular duct, specialized receptor areas. Crista ampullaris in the reach of extension of semicircular canals. Differentiate into the ampulla and the utricle and saccule to form the macula, utriculi, and sacculi. Macula is also special receptor. Cochlear duct. From the saccular part of the otic vesicle are tubular diverticulum cochlear duct, grows and coils the membranous cochlea. And we have the special factor TBX1, expression of the mesenchyme surrounding the otic vesicles, regulates the formation of cochlear ducts by controlling the retinoic acid activity and connection of the cochlea with the saccula to form the ductus rhoeneus, soon formed. Inside the spiral organ, differentiate the cells in the wall of the cochlear duct. Look at this one, we have seen this very good thing. How does it form? Ganglion cells of the vestibular cochlear nerve, cerebral nerve 8 migrate along the coils of the membranous cochlea and to form the spiral ganglion. Auditory nerve. Okay, and the membranous labyrinth. As the membranous labyrinth enlarges, vacuoles appear the cartilaginous otic capsule and soon coalescent the perilymphatic space. The membranous labyrinth now suspended in perilymph. The perilymphatic space with the related to the cochlear duct develops to the division, and scala tympani and scala vestibuli will to form. Bony labyrinth of internal ear surrounded by inside the membranous labyrinth. Ordinary is good developed around 22nd week. And we have seen how does this cells is classified and differentiated from the multilayer pseudostratified epithelium into the double layer of epithelium. And we have the middle ear. But the time of our lecture is very short. Maybe now we will finish our lecture, but we need to know that in the middle ear we have a distal part of repressed expanse of the bicausal tympanic cavity, which gradually develops in the small bones of the middle ear, auditory ossicle, malleus, incus, and stapes, their tendons and ligaments, and chorda tympani nerve. And we have to see how the first pharyngeal groove to give rise to formation of external auditory meatus and external ear. Next, this is first pharyngeal porch to form the auditory tube and middle ear, and we have the subtympanic cavity differentiates. Tubular tympanic races is visible also here. Well, now middle ear we have on the same components is visible. Auricle, external ear, external acoustic meatus or auditory meatus, the tympanic membrane, the ossicles, stapes interact with the window, oval window. Also we have seen incus, malleus. That's a simple bones which is not single bond which is not growth up. And also we have seen cochlea and semicircular canals, vestibule with elements of sulculus and utriculus. Well, and now to talking about that's again structure of incus, malleus, and stapes, and very fast again cochlea and semicircular canals in utricule. Also we have seen external ears, and the last maybe only two picture which we have to study. This is external auditory meatus, tympanic membrane, one of ossicles is visible here. We also have seen here the utriculus and sulculus. This is spaces of vestibule. Also we have seen here cochlea. This one is cochlea with mediolus inside, and auditory nerve in a special spiral ganglion. Yes, we have also seen the auricle pinna, and another picture which we have seen, this will be organ of Corti. An organ of Corti, scala vestibula, scala tympani, spiral ligaments, stria vascularis, vestibular Reissner's membrane. Also we have seen basilar membrane, spiral ganglion, and we have special cells inside the organ of Corti. That one is a product of cells which is named tictorial membrane, inner and outer haired cells. More correctly, we have seen it here. Types of cells. Look at this one. We have seen here the tictorial membrane, outer sensory cells, haired cells, inner haired cells, tunnel, that's a trigonal shape where is the migrate the optic nerve, auditory nerve. It's to form pillared cells, inner phalangeal cells, which two phalangeal cells support and carry the haired cells. It's possible like haired cells inner and outer. pillared cells to form the tunnel. Also, we have seen here there are some cells in scala media, which is a name like Claudius cells and Hansen cells, Hansen and Claudius cells. And more important, the haired cells. The haired cells of the organ of Corti lie as a single inner row between the inner pillared cells and inner phalangeal cells, with the 3 rows of outer haired cells between the outer pillared cells and outer phalangeal cells. Inner haired cells are similar to type 1 haired cells of vestibular labyrinth. They are short and goblet-shaped, with a nuclei 42, and lying there under base of this is a more slender neck. Typically, they contain 50 or 60 hairs, stereothelia. A very good thing here, this is stereothelia. This is outer, and this is inner. So inner is more random. We have seen here inner and outer. The problem of these cells is sometimes is destroying via some antibiotics and sulfonylamides like problem of cells disintegration after the treatment. Ordinarily happen in time of some diseases, treatment of some diseases, and be very attentive how to use antibiotics and sulfonylamides. And last tectorial membrane we have seen, and histophysiology and structure of crista ampularis and macula. This is macula with athalite stones, and crista ampularis. One of them it provides the linear movement and another circular movement. But our lecture is finished. Thank you very much. I hope we more interesting study this material in practical classes of histology. Again, thank you very much. Have a nice day. Goodbye, students.